I'm Rakin, and I'm a physiotherapist at Adelove Living Care and Rehabilitation Center. Today we'll be talking about World Physical Therapy Day 2023. So let's look at what is World Physiotherapy Day all about. The World Physical Therapy Day is held every year on the 8th of September, which is the day World Physiotherapy was founded in 1951. World Physical Therapy Day is a day when physiotherapists can promote the profession as well as share their experiences and also what their role are in the medical field. So let's look at the World Physical Therapy Day goals. The first one is to show impact. Okay, so they showcase the significant role the profession makes to the health and well-being of the global population. Next is about visibility. So they want to raise the profile of the profession. And the last one is advocacy. So they campaign on behalf of the profession and the general public to governments and policymakers. So let's look at the theme of this year's World Physical Therapy Day. So the focus for this year's World Physical Therapy Day is arthritis, with an in-depth look at some forms of inflammatory arthritis, including rheumatoid arthritis and axial spondyloarthritis. This follows on from the theme for 2022 last year, which focuses on osteoarthritis. So let's talk a bit about what is physiotherapy. So worldwide, the physiotherapy community is divided by the name with three different primary titles used: physiotherapy, physical therapy, and kinesiotherapy. Notwithstanding that within the term physiotherapist, there are also language derivations such as physio, physicos, physio, and physio. Finding a single word to describe the community is always going to be difficult. So in our case, we either use physio, physiotherapist, or physiotherapist. So physiotherapy, as described by World Physiotherapy, is a healthcare profession concerned with human function and movement and maximizing physical potential. It is concerned with identifying and maximizing the quality of life and movement potential within the spheres of motion, prevention, treatment or intervention, habilitation, and rehabilitation. It uses physical approaches to promote maintain and restore physical, psychological, and social well-being, taking into account variations in health status. It is science-based, committed to extending, applying, evaluating, and reviewing the evidence that underpins and informs its practice and delivery. The exercise of clinical judgment and informed interpretation is at its core. So here it says that basically we're focusing on mainly the movement and function for humans. Okay, so this includes things like prevention of injury or illnesses, treatment, rehabilitation, and also rehabilitation. Aside from that, it also says that our practice here is mainly based on evidence-based. So it's been tried and has been researched to see its effectiveness before it's implemented in physiotherapy. Let's look at some articles concerning physiotherapy in Malaysia. So here in BNN, Malaysia expands Madani medical schemes nationwide, enhances physiotherapy services. So this article is quite brand new, which was 1 week ago from the day we're recording this. So amongst the things that are stated in these articles, also include two things. First is improving physiotherapy services, and the second is measures to boost physiotherapy services. So, alongside the expansion of the Madani medical scheme, the health minister confirmed that efforts are underway to increase the number of physiotherapists in the country. The current ratio of Ministry of Health physiotherapists to the Malaysian population stands at 1 to 17,878. On the other hand, the ratio of government and private physiotherapists to the population is 1 to 6,800. So both these figures fall short of the World Health Organization's recommended ratio of one physiotherapist for every 2,000 residents. So here, to summarize, is saying that in Malaysia, the numbers of physiotherapy, regardless of government, private physiotherapists, or both combined, is falling behind on the recommended ratio from WHO. Okay, saying that Malaysia is not enough physiotherapists. So the measures to boost physiotherapy services. To address the scarcity of physiotherapists, the ministry has outlined a series of measures. These include increasing the number of graduates from the Ministry of Health Malaysia Training Institute's diploma and physiotherapy program. So in 2022, 76 graduates have completed their studies from the program, marking a 46% increase compared to 52 graduates in 2020. Additionally, the ministry has appointed physiotherapists on a contractual basis, with 207 currently serving in the ministry as of August 31st. In conclusion, the Malaysian government's decision to extend the Madani medical scheme nationwide and its initiative to boost physiotherapy services are significant steps towards improving healthcare access and services in the country. These measures are expected to provide relief to the lower income group and improve the overall health outcome of the population. Okay. So let's talk about arthritis a bit, as it is the theme of this year's World Physical Therapy Day. So arthritis literally means joint inflammation. So redness, swelling, and increased warmth of the joints. Joints are places where two bones meet, such as your elbow or knee. There are many different types of arthritis with different causes and treatments. In some types, other organs such as your eyes, heart, or skin can also be affected. Common symptoms of arthritis include pain, redness, heat, and swelling in your joints. If you have arthritis, it is important for your doctor to diagnose the type of arthritis you have so that you can get the proper treatment. Fortunately, current treatments allow most people with arthritis to lead active and productive lives. Okay. So here it says arthritis is basically a condition that affects your joints, okay, which is the point where two bones meet, and it could also affect other organs in some of the types of arthritis. And the common symptoms include pain, heat, redness, and also the surrounding area of your joints can display swelling as well. So it's important for you to get the proper treatment and get diagnosed properly first to know what type of arthritis you have. So here are some of the common arthritis that we can see or find. First one is ankylosing spondylitis, which is inflammation and swelling of the area around your spine joints, okay, your spine bones and spine joints. The next one is gout, which is also a type of arthritis, which is affected by an accumulation of uric acid crystals, commonly at your great toe joints and also the knee joint. The next one is juvenile idiopathic arthritis, affecting mostly children. Okay, and this is the most common form of arthritis in children. Next one is osteoarthritis, which is, I believe, the most common type of arthritis out there. And this one is affecting the area between your bone, your actual bone, and your joints. And then we have psoriatic arthritis, which comes from the psoriasis, which is an infection of your skin. So what happens is the immune system causes inflammation at the area which is present on that skin area, and because of that, the immune system can also cause inflammation at the joints if that skin area is close to a joint. Next is reactive arthritis, which is triggered by a bacterial infection. Could be from sexually transmitted, or it could be from what you eat, foodborne. So your food is contaminated, you can also get reactive arthritis. And it's most commonly amongst people with this particular gene, HLA-B27. However, good news is it often improves by itself within the first few weeks to a month. And then there is rheumatoid arthritis, or RA for short. So this one actually affects the joint itself. So what happens is due to malfunction or a change in your immune system, your immune cells themselves attack your joint cells, which causes inflammation and swelling there, and it's quite painful. So to summarize the types we went through just now, the first one is ankylosing spondylitis, which is a type of arthritis that causes inflammation in the joints and ligaments of your spine. Second one is gout. It's a type of arthritis that occurs as a flares, typically in your big toe or lower limb. Then we have juvenile idiopathic arthritis, which is the most common type of chronic arthritis that affects children. Osteoarthritis is the most common type of arthritis and is more common in older people. Psoriatic arthritis can occur in people who have psoriasis, which is scaly red and white skin patches, very itchy. It affects the skin joints and areas where tissues attach to the bone. Reactive arthritis is caused by an infection in your body, and the symptoms often clear up on their own within a few weeks or months. And then rheumatoid arthritis, which is an autoimmune form of arthritis where the immune system attacks the healthy joints and tissues. Okay. So let's look at the role of physiotherapy in arthritis treatment. So the goals of physiotherapy for arthritis is firstly to improve the mobility and restoring the use of affected joints. Secondly, to increase the strength to support the joints. Third is to maintain fitness. And fourth is preserving the ability to perform daily activities. So what can a physical therapist do for you? To start, an individualized plan of exercise is developed. So, your physiotherapist will tailor a an exercise regime suited for you, for your fitness level, and for your current condition. These exercises are designed to improve flexibility, strength, coordination, and balance to achieve optimal physical function. So, physical therapists teach you proper posture and body mechanics for common daily activities to relieve pain and improve function. So, they teach you the proper ways to position your back, your posture, as well as your limbs affected, so that you can relieve pain and also improve the function, meaning that the use of your limbs. Next is to show you how to properly use assistive devices such as walkers and canes. So if needed, they will prescribe you walking frames or walkers or quadripod or even walking canes. So they'll teach you how to get up from sitting using the cane and how to walk with it properly. Third is they will recommend different treatment options such as braces and splints to support the joints, shoe inserts to relieve stress on the lower extremities, and hot and cold therapy to ease joint pain and stiffness. So they'll give you a list of treatment options that they will recommend for your condition that is suitable for you as well. And the fourth one is they will suggest modifications to your environment, such as ergonomic chairs or a cushioned mat in your kitchen to relieve pain and improve function. So, possibly if you're working on a uh, desktop work office, then they will recommend a suitable ergonomic chair for you to have. So, it will support your spine and back and other modifications in your houses that will make your living much more easy. So let's look at some of the treatment options that they may give you if you have the listed types of arthritis. So first one is either they will give ice pack or hot pack. So ice pack they will usually fill in with ice, so it's cold. Hot pack, they will soak in a hot bath for a number of minutes to get the optimal temperature needed for the treatment. So, based on this article, cold or hot modalities are the most commonly used physical agents in arthritis treatment. So, this is maybe one of the more common ones. It is well known that cold application is mostly used in acute stages, whereas hot is used in chronic stages of rheumatoid arthritis. So, in the case of rheumatoid arthritis, um, they will usually recommend hot packs or hot modalities. Okay, so rheumatoid arthritis is usually in the chronic stage, meaning that the patient usually has it for a long time already, so they would recommend hot pack. Whereas in acute stages or arthritis that recently just formed, so they would recommend more of a cold application like cold pack or ice pack. So by using heat or analgesia, by using heat, analgesia is accomplished, meaning that pain relief will be accomplished, muscle spasm relieved, and elasticity of periarticular structures obtained. Heat can be used before exercise for maximum benefit. Thermotherapy may be applied as a superficial hot pack. Infrared radiation, paraffin, fluidotherapy, or hydrotherapy. So these are all other examples of thermotherapy or hot applications. Applications are recommended for 10 to 20 minutes, once or twice a day. So they recommend either the cold or hot application for between 10 to 20 minutes, once or twice a day. Caution is necessary in patients with sensorial deficits and impaired vascular circulation in hands and feet because of burn risks. So patients with altered sensations in their hands and feet, as well as poor blood circulations to the hand and feet, are recommended for caution. Okay, be careful when you apply for hot, as if you're not monitoring, it could cause burns. Cold application is preferred in active joints where intra-articular heat increase is undesired. So especially in acute stages or most recently just developed the arthritis, it's more recommended to get cold application for your pain, as that area is most likely the heat has been increased there and it's warm to the touch. So it's much better to get something like ice pack and ice gel. So cold pack, ice, nitrogen spray, cryotherapy are different methods of applying cold therapy. Let's look at a different modality, which is electrical stimulation. So two of the more common types of electrical stimulations we use in physiotherapy for arthritis is TENS machine and interferential therapy. So here's another article talking about electrical stimulation. Electrostimulation is used in patients with rheumatoid arthritis to relieve pain. Transcutaneous electrical nerve stimulation, or TENS for short, therapy is the most commonly used method. So they're referencing Mannheimer and Carlson, who applied TENS at various frequency and reported that the highest frequency TENS was the most beneficial, with an analgesia that persisted up to 18 hours, meaning that if you apply at the highest frequency of your TENS machine, they mentioned that you can get pain relief up to 18 hours post-treatment. Various studies have reported an increase in hand grip strength after daily application of 50 minutes of the TENS, and a decrease in pain after using TENS once a week for 3 weeks. Levy and colleagues observed reduction of synovial fluid and inflammatory exudate following TENS application in acute arthritis, and suggests that pain relief may be partially explained by this effect. Post-operative pain control by TENS therapy following knee joint arthroplasty reduces need for analgesic drugs and hospital stays. So we're saying here that using TENS after surgery has shown very good or beneficial for the patient, which helps them to reduce the usage of pain relief drugs, as well as minimize their stay in a hospital. Due to the variations between materials and methods of the studies, it is difficult to interpret TENS application. Nevertheless, TENS is generally a short-acting therapy, which helps to relieve the pain within 6 to 24 hours, and the most beneficial frequency is at 70 Hz. There's also a high placebo effect. It cannot be used in every painful joint simultaneously, which is disadvantageous in patients with polyarticular involvement, meaning that one of the disadvantages of TENS is you cannot use in different joints at the same time, which is not really beneficial for patients who have arthritis at different joints. Interferential current can also be used for analgesia. Studies, however, have shown its efficacy on pain relief, swelling, and improvement in range of motion, but there are no difference found between interferential current and TENS in the magnitude of analgesia or pain relief, meaning that studies have not found any significant difference of pain relief when using either, when comparing the usage of TENS versus interferential current. So usually your therapist may prefer to go for TENS, as it's a mobile a more mobile machine compared to the IFT or interferential therapy, which is a bit more bulky. And then we have hydrotherapy or exercise in the water. So there has been widespread use of balneotherapy by patients with rheumatic disease since the old times in search of a cure for the ailment. So they mentioned that hydrotherapy or balneotherapy has been widespread or to go to method to treat rheumatic diseases for a long time already. Therefore, there are some suggestions that the science of rheumatology has been developed in balneotherapy. Initially, the term balneotherapy was used to discriminate thermal and mineral water therapy from hydrotherapy, but today these terms are often used interchangeably. So you can either use hydrotherapy or balneotherapy to describe this kind of treatment. In recent years, balneotherapy has served as one of the therapeutic alternatives in other rheumatoid diseases, particularly in chronic degenerative disease, such as osteoarthritis. Objectives of balneotherapy are to increase range of motion, to strengthen muscles, to relieve painful muscle spasms, and to improve the patient's well-being. So it helps to improve the movement of your joint. That's one. Improve the strength of your muscles, and also to reduce those muscle spasms that you get due to pain uh, in a in a long-term phase. Then we have massage therapy or therapeutic massage. So massage is a commonly used treatment tool that improves flexibility, enhances a feeling of connection with other treatment modalities, improves general well-being, and can help to diminish swelling of inflamed joints. So Daunt and colleagues, this other article have reported that pain thresholds both at the massage site and at the knee and ankle have decreased after applying oscillatory manual massage to the intervertebral paraspinal region. Massage is found to be effective on depression, anxiety, mood, and pain. This finding leads to the question of whether there are some changes in peripheral nociceptive perception and central inflammation in rheumatoid arthritis. Also, massage decreases stress hormonal levels. So here they mentioned that massage therapy has a big role in reducing stress levels and mood for the patient, as well as reduce pain, and also helps to improve flexibility and enhances blood circulation to the joint. And lastly, we have therapeutic exercise or exercises that are prescribed to you by your physiotherapist. So muscle weakness in patients with rheumatoid arthritis may occur because of immobilization or reduction in activities of daily living. In that maybe patients may experience feeling weak or their muscles are weak because their fear of moving their joint in a daily basis causes it to be weak. Maintenance of normal muscle strength is important not only for physical function but also for stabilization of the joints and prevention of traumatic injuries. So actually maintaining your muscle strength is very important as it helps to stabilize your affected joint, the joint that is in question. So the muscles there will help to stabilize uh, the structures at the affected joint, so it will help to take out the load or stress at the joint. Another thing is it helps to prevent traumatic injuries, okay, in the future as well. So if your muscles surrounding that joint is strong enough, then it help to prevent uh, injuries that would otherwise be directed to your joint. It may be proposed that exercise therapy has beneficial effects on increasing physical capacity rather than reducing the activity of the disease. Okay, so with that, that should be the end of the talk. I hope you learned a few things about not just physiotherapy, but also arthritis, as that is the theme for this year's World Physical Therapy Day. Thank you for listening.